questions are there? Anybody's mind, anything is going? So all the myths about robotic surgery busted today? Or we still have some more going on there? Yeah, please.
Can I just make one comment?
Please.
This is out of the question which is being asked by a number of our patients who are coming to us. Does robot operates? Right? Robot is doing the surgery, robotic surgery. So in fact, it is the surgeon who is doing the surgery using the robotic system. It's very, very important to understand, and that is why robot is not going to teach the surgery to the surgeon, but it is the surgeon who is going to use the robot as the newer technology to operate. And that is why these courses are important, where we are letting the surgeons understand the technology for the best use for the patients.
I totally agree. Robot is just a tool. It cannot teach you surgery. You cannot become a better surgeon just because you had robot in your hand. No. We have to learn our basics of surgery, anatomy, learning. So it's a long process. But yes, today's simulation, using of other things, does give an edge to younger surgeons to learn it faster than just observing a senior surgeon and learning over years. So we'll benefit that way.
I'll just make two very quick supporting points to excellent points that have been made by my colleagues. First is, in terms of training, you were asking about training. Not only is the learning curve not as steep, but the training yield. So in any training program, you always have to look at the training yield. For the amount of resource you put into training 100 surgeons, how many good surgeons are you getting at the end of training? And with traditional laparoscopy, the training yield has been anywhere from 20 to 30%. So you're talking about, in any business, nobody would invest money in something that gives you a 20% yield, okay? But with robotics, the yield in terms of training surgeons is closer to 80%. So if I train 100 surgeons on the robot, it's very rare that I will find a surgeon that will not be able to get the robot, right? Because again, it's assistive technology. That's point number one. And the other point I wanted to make is with regards to mentorship, right? Right now, we rely on humans to mentor. And I'll put the example of ChatGPT, right? When ChatGPT gives you an answer, sometimes human beings have a very difficult time differentiating was it a human or was it AI that generated this answer? So I'm just going to put this out there because I think it needs to be in the consciousness that over time, AI will play an increasing role in terms of mentoring. It will take up it's called the democratization of mentoring. Right now, it's difficult to find good mentors. Over time, I think that quality of mentorship is just going to get higher and wider.
I think very good point, Dr. Joe. If there are no questions, Leela, shall we call it today? Thank you.
Could I just, please, if you don't mind, the only thing we didn't discuss also was the importance of telesurgery. Roma is a fantastic surgeon. She cannot split herself in two. However, she could operate on somebody...
At the NHS UK? Of course.
In the UK. No, seriously, or she can, this new platform, and it's not a new technology because they've done in the States, remove somebody's gallbladder who the patient was in Paris. The only thing limiting the technology is the speed of the... the speed of the connection. That's it, the internet. Because if it's less than 200 milliseconds speed, then you cannot see the bleeding as quick. So really that revolutionized, it brought experts, to different area where it's not available.
Absolutely.
And then it's really, it's only the start of the journey,
That's the future. Today we are in telepresence. That means the surgeon is present in the same operating room, but the remote surgery is not far. I'm sure in a few years' time we'll have another such face-to-face meeting about that as well. Thank you so much. And I really appreciate all members of the press for taking your time out, for joining us today to understand and hear what this Association of Gynaecological Robotic Surgeons, which is a national body, is thinking and planning in the next few years. We have 2 days of conference starting from tomorrow morning, It's a very dedicated conference, starts at 8 o'clock in the morning and ends around 6 in the evening. So you can understand there's a lot of teaching going on there. We have an inauguration happening around 12, where Mrs. Sangeeta Reddy, the Joint Managing Director of Apollo, and Mr. Jayesh Ranjan, IAS Secretary of the Information Technology, will be inaugurating our meeting. I invite all of you to be there for the inauguration ceremony tomorrow around 12. And the conference will continue on Sunday and it ends on Sunday. We will be giving our first set of trainees, first set of surgeons who have got trained with us, the certification on Sunday at the valedictory. Thank you all for coming today, and I really appreciate your time. Oh, okay, so this meeting is at Sheraton Hotel, Financial District, at the Gachibowli. Yeah, that's tomorrow. Thank you all. Namaste.